right, Mr. Smith. Are you in any pain today? Let's do this. On a 0 to 10 scale, I want you to tell me where your pain is at. 0 meaning no pain at all, and then 10 being the most pain you've ever experienced in your life.
This is a numeric rating scale for pain intensity. These scales have been the standard in medicine for measuring pain for decades. This tool was developed to help medical providers better understand a patient's pain intensity level and the changes that occur after treatments, like medications. However, experts have started to understand that getting to 0 is frequently not the most important objective, that addressing physical function and emotional well-being is often as essential to getting patients back to active and productive lives. Many clinicians began to consider that there might be a need for an improved tool to guide the conversation and treatment decisions about pain. These observations resulted in the development of the Defense and Veterans Pain Rating Scale, or DVPRS. At its foundation, the DVPRS begins with the familiar 0 to 10 method of reporting pain. The DVPRS also incorporates other visual cues, including graduated intensity bars, the green, yellow, red color continuum, and a facial pain scale for those who might have difficulty communicating. Additionally, the use of mild, moderate, and severe pain levels correspond to the pain intensity colors and bars. When using the DVPRS, the conversation still begins with you communicating your pain level using the visual cues on the 0 to 10 scale. But what's important about the DVPRS is that the conversation doesn't stop there. The DVPRS continues the assessment beyond pain intensity. An important evolution in the DVPRS is the addition of functional language associated with the 0 to 10 numbers, anchoring your pain experience in terms of how it impacts your level of function, what your providers call functional disturbance. With the inclusion of these anchors, two things are accomplished. First, as you become familiar with these functional anchors, the pain question will have greater meaning to both you and your providers, and the recorded pain values will have greater clinical value. Also, by recalibrating the pain discussion from intensity alone to one that emphasizes your function, you and your clinicians can now discuss pain and measure success of pain management in the larger context of what treatments actually improve your function, thus reducing the likelihood of medication-centric pain management aimed solely at getting the pain to 0. Additionally, because pain often transcends a simple measurement of intensity and affects many areas of your life, the DVPRS also includes some additional questions aimed at providing insight on the impact of pain in 4 key areas: activity, sleep, mood, and stress. These questions take only a few extra seconds to answer, but they provide important indicators of the success or failure of pain management therapies far beyond what is obvious when only focusing on pain intensity. It is not uncommon for many people to remain relatively static with their pain intensity scores for a period of time. However, changes can be observed in the other measures that indicate improvements in a person's quality of life. Assessing these other dimensions of pain is critical to your provider's understanding of how pain might be affecting your overall well-being and can alert to potential physical and psychosocial issues related to your pain. The DVPRS can be used whenever pain is discussed or assessed. It provides valuable information and insight to both you and your healthcare team as you work together to develop appropriate treatment plans for managing your pain.